Well, hello, and welcome to Module 11. So during this module, we will be discussing the care of children and their families that have cardiovascular disease. So many lay persons may use the phrase, a child born with a hole in their heart. So what they're referring to is congenital heart disease. Congenital heart diseases are a leading cause of birth defect associated infant illness and death. Congenital heart diseases occur in almost 1% of all births. About 25% of babies with a congenital heart disease have critical congenital heart disease, which means that they generally need surgery or other procedures in their first year of life. Survival and medical care for babies with congenital heart disease has improved so much over the last few years. I remember being a nurse in the Pediatric intensive care unit where we would care for babies with congenital heart disease. And it was not uncommon to have a baby born with a severe congenital heart disease like hypoplastic left heart. And the pediatric critical care surgeon would talk to the parents and say, it's pretty much your child's not going to survive this disorder. So many times they would not even attempt to do surgery. Now, so much has changed, and the advances that have been made are just simply incredible for congenital heart disease. So during this module, you will learn about the many different types of congenital heart diseases in pediatrics. Some of them that we will review are atrial septal defect, or ASD, which is a hole between the two atria. The ventral septal defect, which is VSD, which is a hole between the two ventricles. Patent ductus arteriosus, and coarctation of the aorta, and tetralogy of Fallot, which is actually 4 different congenital disorders into one, called tetralogy of Fallot. So in order to understand the complex issues of congenital heart disease, you first must remember how a normal heart blood will flow. So remember that when a baby is in utero, their blood flows with a fetal circulation. When they're born, this circulation immediately changes then to the regular circulation of the heart. So if you remember that, what the normal circulation is, that's how an infant's heart blood will flow. So make sure you have a very good understanding of that, because then when you learn the different congenital heart defects, it'll make more sense to you, because the blood will flow in a different direction based on where that defect is. So not all babies are born with signs of congenital heart disease. So it is the pediatric nurse's job to always be on the lookout in all newborns and infants for potential signs of congenital heart disease. So what might these be? Well, they might have a murmur, so you want to understand that for sure. And then also, they may be very subtle signs. So the parents may say the baby sweats when they eat, or they're very fatigued when they eat. They can't keep up. It's like trying to run a marathon, right? So when you're exercising, your heart is working really hard and you are fatigued and sweating. Well, the same thing may happen to an infant who has congenital heart disease, because it's making the heart work extra hard, and that's like their exercise. A 1-month-old isn't going to get up and go on a treadmill, so eating is like their exercise. You also may notice cyanosis, especially around their lips. You may notice that. You may notice cyanosis of their hands and feet. Again, some of this may be normal right after birth, but if it is progressing when they're a couple weeks old, that's not normal. So children and their families with congenital heart disease have unique challenges, partially because the illness or disease is on the inside and it doesn't really appear on the outside that the child is sick. So sometimes this can pose problems for the child and their families. The child may not be able to keep up with their peers. Their activities may need to be limited. because of their severe heart condition. But again, they may look fine on the outside, so this sometimes is difficult for the child. So the pediatric nurse's job is to really help the child and the family through these unique challenges of heart disease.